A very good evening to everyone. This is Shubham. Welcome back to my channel, Medical Concepts. So today I'm going to begin with the playlist for the Krok 1 pathomorphology discussion, or you can say pathological anatomy discussion. So the first topic over here is, so I'm going to discuss these questions from the ministry book. Okay, so please refer that while referring to these questions. And one more thing, if you feel any kind of doubt, okay, while listening to the explanation, so you can pause the video and you may write your own notes, okay, because I will not be able to write everything over here. So I will try to summarize as more as possible, but if you feel anything that you need to write or make your own notes, so you can pause the video and you can do that. One more thing, I will be providing the notes for the same in the description box, so you can check out the notes over there as well. And while referring to these questions, while listening to the explanation, you can refer to these notes in the description box, and you may make your own notes as well. So let's begin with the dystrophies over here. Parenchymatous degeneration. So the first question over here is autopsy of a woman with severe intoxication caused by the sepsis, which was the direct cause of the death, now has shown a tiger heart. So they are talking about the tiger heart. Tiger heart is nothing but the fatty degeneration of the myocardium. Okay, further I will be talking about the tiger heart, what are the specifications of the tiger heart, how it looks macroscopically and how it looks microscopically, because that is important. That is a favorite hot topic for the examiners as far as Krok 1 is concerned. Okay, so I will be talking about that, but for now just understand that tiger heart is the fatty degeneration of myocardium. Okay, so this patient is having the tiger heart. So as I said that this is the fatty degeneration of myocardium, which means fat globules are gonna invading in the myocardium, right? So fat globules are going to be present, lipids are present in the myocardium, which is obviously not good for the heart, right? So microscopically what they show, lipids were there. As I said, lipids or fat globules may be found in the myocardium layer. So lipids were detected in the cytoplasm of the cardiac histiocytes, right? Now what morphogenetic mechanism prevails in the development of the dystrophy? So this is nothing but the decomposition. Okay, so what is this process? This is actually decomposition. So this is the decomposition. Now what is decomposition? Let me tell you, decomposition is also called as phanerosis. Okay, in case if they don't give this option decomposition, so you can mark this option as well, phanerosis. Now what is this? This is actually the disintegration of the membranous structures of the cells and extracellular matrix. Okay, so what does it mean in the simple words? That whatever structures are present over there, they will not be aligned in the proper manner wherever they are present. For an example, if I am talking about the cardiac histiocytes, lipids should not be there, isn't it? But if the lipids are present, which means what is happening, they are going to disintegrate the normal anatomy of the membranous structure of this cardiac histiocytes, isn't it? So that is the thing which I'm talking about as far as decomposition is concerned. So decomposition also called as phanerosis, and this is nothing but the disintegration of the membranous structures of the cell or the extracellular matrix. So this is about the decomposition process. So if they're talking about the tiger heart, which process or which kind of dystrophy is going on over there? That is the phanerosis, or you can also call that as decomposition. Okay, done. Second one is during the electron microscopy, examination of liver biopsy material, a great amount of flat cisterns. Okay, so remember they are talking about the electron microscopy, and they are doing the biopsy of the liver. Now during the biopsy, a great amount of flat cisterns and the vesicles with secretory granules, okay, vesicles are also there with the secretory granules surrounded by the membrane, were found among numerous mitochondria, which is the powerhouse of the cell. The hyperplasia of what ultrastructure is meant? So this is a simple biology question. This is not the pathomorpho question, but still you can consider it over here. This is a biology question, simple biology. 11 12 classes we have learned that what are the basic structures inside the cell, what are the structures present in the cytoplasm of the cells, right? What can be the various kind of cell organelles which are the part of the cell. So they are talking about one of the cell organelle over here, and you may get the hint from these various things. For example, they are talking about the flat cisterns, they are talking about the vesicles with the secretory granules. Yes, they are talking about the Golgi complex, right? They're talking about the Golgi bodies of Golgi complex. So here for your understanding purpose, I have actually inserted the diagram over here, which you can see. This is the diagram of the Golgi apparatus, as you can see in the screen. Okay, so what you can see over here, you can definitely see that this is the cis face, this side is the cis face. Okay, and obviously opposite to that, that will be the trans face. So this structure over here, which you can see, this is the trans face, right? Here you can see lumen between that. So this part is the lumen, right? This part is the lumen between that. Now these are the cisternae, right? Where the cisternae? So these one, they are the cisternae over here, right? They are the cisternae, right? All these structures are the cisternae, right? And at last you can see that they are the secretory vesicles. These are the secretory vesicles. Okay, they are nothing but the secretory vesicles. So in our question, they were talking about what? They were talking about the flat cisterns. They were talking about the vesicles with the secretory granules. Yes, these are the vesicles which are secretory. As you can see, these are the vesicles which are secretory. So they are talking about which structure? They are talking about the Golgi complex. This is a simple biology question, right? They can talk about the mitochondria. They may ask you the mitochondria. You can say that they may ask you that there are the cristae present over there, double membranous structure is there, so what are you expecting? So that can be the mitochondria. Or they may ask you any other thing. For example, they may ask you the ribosome, they may give you the protein synthesis unit, okay, or they may ask you 50s or 30s subunits are there, which structure we are talking about there. This is the ribosome. So these cell organelle structures, they can be asked actually in the exam, right, from the biology section. So let's move on and let's talk about the third question over here. So in the third one, they are saying that autopsy of a, so what was the answer over here? Let me mark for you. This was the Golgi complex, right? Okay, moving on to the third one. Autopsy of a 49-year-old man who was hospitalized with symptoms of hepatotropic, what? Hepatotropic intoxication. Yes, you might have got it, that they are talking about the liver right now. Hepatotropic intoxication, and suddenly died. Has shown an enlarged liver of yellow brown color and soft consistence. Drops of fat are noticed on liver cut surface and on the scalpel from which they are doing the cutting or autopsy. Microscopically, very important. Look, there are two things which you need to emphasize on as far as pathomorphology or pathanatomy is concerned. One is the macroscopic finding and other one is the microscopic finding. Okay, so you need to be very clear between the macroscopic and the microscopic things, right? So here they are talking about the microscopically peripheral hepatocytes of classical liver lobule. You know, we are having the various kind of lobules in the liver. If you talk about the histology of liver, classical liver lobule or portal lobule, right? So they are talking about the classical liver lobule contains small drops that fill cytoplasm and push the nucleus. Very, very important point over here, that push the nucleus to the periphery. Okay, this is the important point which you need to emphasize on. Okay, and what we are talking about? We are talking about the microscopically, right? So two findings you can appreciate over here. One thing is that enlarged liver was there, which means they are talking about the liver, definitely yellow brown color and soft consistence. As far as microscopically they are talking about, they are saying that pushing the nucleus to the periphery. Okay, the drops, small drops that are filling the cytoplasm, they are pushing the nucleus to the periphery. What does that mean, or what they are talking about? Okay, they are actually talking about the fatty degeneration. These are the small drops. What drops are these? These are the fatty drops. Okay, so fatty degeneration of liver, what do you know about that? Look, as I said, macroscopically and microscopically, two findings you need to emphasize on. Macroscopically, what they gave you. First of all, let me talk about the fatty degeneration of the liver in very, very brief. Okay, don't worry, I will be providing notes in the description box also, or you may pause the video and you can write your own notes. Okay, fatty degeneration of the liver, as far as macroscopic findings are concerned, macroscopically this fatty liver is actually enlarged with the rounded margins. Okay, this is enlarged with the rounded margins, and the cut surface actually bulges slightly. Okay, and is pale yellow and it is greasy to touch. Okay, pale yellow and it is greasy to touch actually, and that's what they are talking about, yellow brown color, right? Yellow brown yellow brown color and the soft consistence, right? Now this is called as goose liver. Okay, this is called as goose liver. So here I am writing it. This is called as what? This is called as goose liver. So if somebody will be asking you or if the examiner is asking you, goose liver can be found in, this can be found in definitely fatty degeneration of the liver. In which finding, macroscopic or microscopic? Definitely macroscopic finding of the fatty degeneration of the liver tells you about the goose liver. Okay, again, what is the goose liver? Cut surface actually bulges slightly and it is actually pale yellow and greasy to touch. This is the macroscopic finding. Now let's move on to the microscopic finding. Microscopically, what you can found? Actually, there are the numerous kind of lipid vacuoles are present in the cytoplasm of hepatocytes, which can actually push the nucleus towards the periphery. Same thing was happening over here. Microscopically, what they were telling you, there are the peripheral hepatocytes in which of the classical lobules in which there was classical small drops. What are those small drops? They are the fatty drops. These fatty drops in the cytoplasm, they are the lipid vacuoles in the cytoplasm, which are actually pushing the nucleus towards the periphery, isn't it? They're pushing the nucleus towards the periphery. I can give you the example over here. For example, look over here. If this is the cell, or if this is the, I will be talking about proper lobule. For an example, this is the classical hexagonal lobule of the liver. Okay, I'm not going into the detail of this one, that where is the central vein and all these things, sinusoids and all. I'm just simply telling you that if this is the nucleus, let's say, right, if this is the nucleus and if this is the cytoplasm, okay, around it in the white structure, and this is the fatty globule in the cytoplasm. Okay, these are the fatty globules present over there. These are the fatty globules. Okay, what they will do, they will actually push this nucleus. They will actually push this nucleus towards what? Towards the periphery, and over there now gradually it will be pushing towards the periphery and it will be reaching towards here. Okay, that's what I'm talking about, right? So it will be pushing towards the periphery. So what they do, and what are these one? What are these one? They are the fat globules, right? They are the fat globules, or you can say lipid vacuoles, rather you can say lipid vacuoles. Okay, so what you can say, they are the lipid vacuoles. Okay, clear? So that's what I was talking about. Fine. Okay, I hope this one is clear. So answer is very clear. That is the fatty degeneration of the liver. Okay, so you need to talk about you need to understand about the macroscopic and macro and microscopic findings. Fourth one, autopsy of a 62-year-old man. So he is the old man. Okay, and autopsy is going on, whose death occurred, most of the cases are related to the autopsy or after the death. As far if you're talking about the pathomorphology or pathonatomy, you are talking about the dead cases already. Okay, in most of the situations. Autopsy of 62-year-old man whose death occurred against the background of progressive cardiac insufficiency. Okay, progressive cardiac insufficiency, and has shown an enlarged heart of soft consistence. Chambers are extended. Very important. Chambers are extended on the autopsy. Okay, myocardium is luster yellow on the cut. Okay, very important finding. Yellow on the cut. From the yellow means what? Some kind of fat can be there, right? From the endocardium side, yellow white banding can be seen. Very important. And most evident where? In the papillary muscles. Most evident where? In the papillary muscles. Typical findings of the tiger heart they are giving you. Okay, what I am talking about over here, I am talking about what? I will be writing it with the red one. I am talking about the tiger heart. In the first question itself I mentioned about the tiger heart, that this is the another name for the fatty degeneration of the myocardium. Now let me talk about the findings over here. As I told you, what you need to emphasize on? Macroscopic and the microscopic findings. What are the macroscopic findings? Let's talk about that. So just before this question I have already talked about, in the third one I have talked about the fatty degeneration of the liver. Now I am talking about the fatty degeneration of the myocardium, or you can say, because myocardium is the most important layer of the heart, so I can say that I am talking about the fatty degeneration of the heart. Okay, so what are the findings? First of all, it is also called as tiger heart. That is very important. That is very obvious. Why, by the way, why we are calling it as tiger heart? Because it is having the pattern of the skin of the tiger, isn't it? So that's why we are calling that as tiger's heart. Macroscopic and microscopic. Now let's talk about that. So if you talk about the macroscopic finding, heart is enlarged and the chambers are stressed and flabby. Okay, they have already mentioned about this one, that chambers are extended. Okay, so it means what? It means they are talking about the macroscopic finding over here. They are talking about what? They are talking about the macroscopic finding. So this is the macroscopic finding, right? So this was what? This was the macroscopic finding. Chambers are extended over here, right? Chambers are stressed, chambers are flabby. It means they are talking about the macroscopic finding of the fatty degeneration of the heart or the tiger heart. Microscopically, you can see dust like fatty vacuoles in the cardiomyocyte. Okay, dust like fatty vacuoles in the cardiomyocytes. This is the finding microscopically. And one more thing, where you can observe that? You can observe in the papillary muscles and trabeculi of the ventricles in the form of bands. Okay, so this is the microscopic finding. Which one? These papillary muscles. This is what? This is the microscopic finding. This is the microscopic finding, right? So macroscopic finding is dust like macroscopic finding is heart is enlarged, chambers are stressed and flabby. Okay, chambers are extended, right? Microscopic finding is that there can be the yellow, white or dusty like fatty vacuoles, lipid vacuoles, fat vacuoles, okay, whatever you can say, in the cardiomyocytes. Okay, along with that, location is very important. Papillary muscles. Okay, papillary muscles and the trabecules of the ventricles. Okay, here they are not talking about trabecules or ventricles, but they are talking about the papillary muscles in the form of bands. They have already mentioned about that, in the form of yellow white bands. Okay, so it means they are talking about the microscopic finding of the fatty degeneration of the heart or fatty degeneration of the myocardium layer. Okay, so definitely the answer will be option B, fatty degeneration of the heart or fatty degeneration of the myocardium. I hope this question is clear. Let's move on to the next one, fifth one. A solid gray patch with irregular shape, uneven surface. Okay, irregular shape, uneven surface and clear borders were detected on the tongue. They are talking about ventral surface of a man with dental prosthesis on the lower jaw. During the histological study of the mass, there was noted the lymphomacrophage infiltration of subjacent connective tissue, preserved structure of the stratified pavement epithelium. It's thickening due to prickly and basal layers of the skin. Hyperkeratosis, very typical finding of the leukoplakia. Hyperkeratosis is very typical finding for the leukoplakia. Along with that, many kind of hints are given itself in the MCQ, which you need to pick up. Hyperkeratosis, first one. Second thing, hyperkeratosis is there, irregular shape is there, uneven surface is there, clear borders are given, lymphomacrophage infiltration is given. They are talking about leukoplakia. Okay, so how it looks, leukoplakia? This looks like this. Okay, this looks like this. What you can observe over here, I can make an arrow. For example, I am talking about which structure? I am talking about this thing. Okay, so look at the borders, right? Sharp borders, you can see, clear borders, right? Irregular shape, uneven surface, as you can mention, right? So leuco means white, okay, plakia means plaque, so this is a white plaque over the tongue. They were talking about the tongue, right? So this is what hyperkeratosis is, the typical finding of this one, right? So this is the diagram which you can appreciate on your screen right now. This is the leukoplakia. Okay, now leukoplakia may develop whenever there is a hyperkeratosis. So there are the white patches of the hyperkeratosis. So whenever you see the hyperkeratosis thing, okay, whenever you are talking about the uneven surface, clear borders, right, or irregular shape, they are in the tongue, definitely they are talking about the leukoplakia. Okay, what is erythroplakia? Erythroplakia means red colors of plaque, okay, but over here they are the white color of plaque. One more thing, lymphomacrophage infiltration, which means they are going to impart which color? White color, definitely. So this is the leukoplakia, right? So answer is leukoplakia. I hope this is very clear. Okay, in the previous question also you can see the image over here that these are the fatty, this was the tiger heart definitely, right? So the fatty degeneration of the myocardium you can see. So you can see that yellow, right, this yellowish mass over here, this yellowish mass which is covering this whole myocardium layer. Okay, and even if you zoom over here, these are the this is the fat globules, right? Fat globules invading the myocardium, fat globules invading the myocardium, which cause the death of this unfortunate patient, right? Okay, so that was about this, right? Okay, so now let's move on to the next one. We have talked about the fatty degeneration of liver, myocardium. Okay, we have talked about the leukoplakia. Now let's move on to the mesenchymal degenerations now. So let's talk about the sixth one. Okay, so sixth question is 66-year-old patient had peritonitis 10 years before his death. On cut, the liver and spleen capsules are much thickened here and there, packed and translucent. Translucent is very important over here. Okay, now he was having this patient was having the peritonitis 10 years before his death. Okay, remember, peritonitis was 10 years before his death in his history, and when on autopsy you cut the liver and spleen, what you found that the capsule is very thick, and here and there, okay, they are packed and translucent. You can say translucent, what is that? You can say that they are talking about a semi-transparent thing. Okay, and where you can find the semi-transparent thing? Glass-like structure. Okay, what I'm talking about? Glass-like structure. Glass-like structure, what do you mean by that? Glass-like structure means hylos. In the Greek, glass-like I'm talking about, glass-like, glass is transparent, glass-like structure. Glass-like means what? In Greek we call that as hylos. And abnormal condition of this hylos will be called as hyalinosis, isn't it? Hyalinosis. So what you need to pick up over here, they are talking about the translucent thing. In the capsule of the liver and spleen, these capsules were thickened here and there, and they are showing you the persistence of the translucency. They are translucent. Translucent means glass-like, semi-transparent. They are talking about the hyaline. Hylos, hyaline. Hylos is Greek, which means glass-like structure. That is the hyalinosis. So definitely your answer will become what? This is the hyalinosis they are talking about. This is what they are talking about, hyalinosis, right? Then you will be asking that what do you mean by the mucoid swelling or the fibrinoid changes, because you are hearing about these kind of terms in your whole duration of the reading of this pathomorphology. So let me talk about some of the few differences which you can figure out while you are solving the questions as far as mucoid swelling or fibrinoid changes are concerned. Some more details I will be providing in the description box itself, right? Or you can pause the video and you can listen to the differences carefully. So mucoid swelling, first of all you should know what is the meaning of this mucoid swelling and the fibrinoid changes. First of all, mucoid swelling is the reversible thing, fibrinoid changes is the irreversible thing, right? Mucoid swelling is a superficial reversible disorganization, right? It is a superficial reversible disorganization of the connective tissue. Now these processes are associated with the swelling of the collagen fibers. Remember, I am talking about the mucoid swelling. Okay, so mucoid swelling is first point, superficial reversible disorganization of the connective tissue. Second thing, swelling of the collagen fibers. Vascular permeability is increasing, right? Microscopically, metachromasia is seen. Macroscopic appearance is absent in the mucoid swelling. Fibrinoid changes, it is deep irreversible connective tissue disorganization. So mucoid swelling was reversible, fibrinoid changes is irreversible. Next point, macroscopically. First of all, let me talk about the microscopically. Metachromasia is not marked. Metachromasia was marked. Metachromasia was present in the mucoid swelling, but in the fibrinoid changes, metachromasia is not there. Okay, fine. Fibrinoid swelling further, it may be generalized. For example, in the systemic disease, it can be present in the systemic disease of the connective tissue, or it can be present in the localized tissues as well, for example in the chronic inflammations, right? So that was the common point, that was a common differentiation which you can make out in the fibrinoid changes or the mucoid swelling. Okay, so this particular question was having the answer as hyalinosis because they were talking about the translucent structure. Okay, so I hope this is clear. So further notes you can refer always in the description box. Okay, seventh one, or you can pause the video and listen to the explanation. Seventh one, autopsy of a 40-year-old woman who was ill with the rheumatoid arthritis and died has shown an enlarged solid spleen. The tissue is of brown red color. Tissue is of brown red color with the enlarged follicles that look like translucent grayish white grains. Very important finding. Okay, remember this is the macroscopic finding. Microscopic, what are the difference? Macroscopic you can appreciate with the eyes, microscopic obviously you need the microscope to appreciate that finding, right? So macroscopically with the naked eyes you can appreciate the grayish white grains over here. So what kind of pathological process they are talking about? Definitely you must have guessed, many of you must have guessed it already, that is the Sago spleen. Yeah, definitely this is the Sago spleen. Now how you can actually appreciate the Sago spleen macroscopically? So here I'm having some difference between the two kinds of spleen. Actually very famous one is the Sago spleen and one is the Lordaceous spleen. Okay, now Sago spleen, so let's look over to the screen over here right now. So Sago spleen is the nodular one. On the other hand, Lordaceous spleen is the diffuse. Okay, Sago spleen is the nodular one, Lordaceous spleen is the diffuse. Sago spleen is having the moderate enlargement, whereas Lordaceous spleen is having the moderate to marked enlargement, right? All the differences are very important. Okay, so do not ignore them. Now clinical symptoms, what are then, or clinical signs you can say? Translucent waxy nodules resembling the sago grains. Resembling what? Sago grains. Okay, now what do you mean by sago grains? साबूदाना तो आपको पता होगा, साबूदाना की खिचड़ी, साबूदाना की खीर खाई होगी आपने कभी, तो वही साबूदाना है ये. So what are these sago grains? Sago grains are those sabudana. Okay, so you may actually remember the structure, how it looks macroscopically, how you can appreciate that. So same kind of structure, I hope you can remember, I hope you can identify over here. So sago grains, Sago spleen, okay, or you can say sabudana spleen, whatever you can say, okay, for the remembrance purpose. On the other hand, Lordaceous spleen, moderate to marked enlargement. Clinical symptoms, map-like area resembling lard. What is lard? Lard is kind of an animal protein. Okay, you can see, okay, not looking very nice. Microscopically, deposits start in the wall, splenic cyanosis. Simple, very simple. Just remember what? Just remember this thing. Sago spleen, they are actually interfering with the white pulp. Lordaceous spleen, they are actually interfere with the splenic cyanosis, which is the part of what? Which is the part of your red pulp. Okay, remember this thing, that's it, right? Sago spleen, which one? White pulp. It looks white, so it will be interfering with the white pulp. Lordaceous spleen, red pulp, okay, because only two pulps are present in the spleen, right? So white pulp, Sago spleen, red pulp, Lordaceous spleen. Okay, fine. So now let's move on to the next one. I hope this one is clear. This was the easy one. So grayish white greenish, Sago likes grains, so that is the Sago spleen. Let's move on to the next one, 8th one. 40-year-old man during 10 years after the tibia fracture had chronic osteomyelitis in 3 years, accompanied by nephrotic syndrome. Uremia caused his death. Autopsy has shown packed white kidneys with scars in the cortical layer have sebaceous glow on the cut surface. Determine the pathology that has developed over here. So what they are talking about? Look, we are actually having the anxiety, or you can say we are having that excitement to mark the answer as glomerulonephritis if you are talking about the nephrotic or nephritic syndrome directly, right? Over here also they have mentioned about the nephrotic syndrome because they're already mentioned about the uremia also. Uremia caused his death, so glomerulonephritis is given in the option, and moreover they are saying that in 3 years, guys, in 3 years accompanied by the nephrotic syndrome, definitely you can say this is the chronic condition, and you may mark the answer as chronic glomerulonephritis. But remember, that will be wrong. Okay. Now, many of you may not have marked this one, but most of the guys, they may have this interpretation. Look, nephrotic syndrome, definitely yes, they are interfering with the kidneys, but it doesn't mean that every time they are talking about glomerulonephritis. You need to be very aware about or very careful about the history of the patient. Now let's read the question carefully once again. so that we do not miss out any point. So a 40-year-old man during 10 years of the tibia fracture, he was having chronic osteomyelitis. That is a very, very important point. Okay, chronic osteomyelitis in 3 years. So what is happening after the chronic osteomyelitis? This patient is having then nephrotic syndrome, right? And then uremia happened, and that caused the death of this unfortunate patient. Now an autopsy has showed that packed white kidneys with the scars in the cortical layer, okay, as sebaceous glow on the cut surface. Okay, they are talking about what? They are talking about actually amyloidosis. Now, is it primary or is it secondary? Definitely it's gonna be secondary one, because first of all the patient was having chronic osteomyelitis, and after that, after 3 years, the patient shifted to the kidneys disorders, right? Due to that, uremia happened. So first of all, chronic osteomyelitis was there. Okay, first of all what? First of all, chronic osteomyelitis was there, then nephrotic syndrome came, nephrotic syndrome came, and then uremia happened, and which leads to the death of this patient, right? This is the case of secondary amyloidosis, because it is happening because of osteomyelitis. After the osteomyelitis, then nephrotic syndrome or uremia happened, which leads to the death of this patient. So this is the case of secondary amyloidosis. Now let me talk about the amyloidosis over here. What is the amyloidosis? It is actually the term which is used for the group of the disease whenever we are talking about the extracellular deposition of some proteinaceous substance, and this proteinaceous is obviously not physiological, that is obviously pathological. So these amyloid pathological proteins, wherever they will deposit, they will cause the destruction of that particular functioning of the or physiology of that person, right? So over here what happened? First of all, chronic osteomyelitis was there, then it moved on to the kidneys. It destroys the anatomy and physiology of the kidneys, and which leads to the uremia, which leads to the death. Okay, so secondary renal amyloidosis, I would like to give you some examples which you can remember over here. They use the example of chronic osteomyelitis in the Krok 2 paper, in the Krok 2 question, in some of the question of the previous years. They used the term as ulcerative colitis. Same situation was there as well. Instead of chronic osteomyelitis, they gave the term as ulcerative colitis. Okay, so you should remember some of the important inflammatory disease or some of the important carcinomatous disease which can lead to secondary amyloidosis later on in the patient. Okay, so what are these ones? Secondary or reactive amyloidosis. Look, some of the tissue destructions conditions, some of the inflammatory conditions. For an example, first of all, it can be chronic infectious or it can be non-infectious. Okay, it has to be chronic. For an example, bronchiectasis can be there, TB can be there, chronic osteomyelitis itself they gave in the question, chronic pyelonephritis can be there. Okay, some of the autoimmune disorders can be there. For an example, scleroderma, rheumatoid arthritis. Okay, inflammatory bowel disease. Then, as I mentioned, in the Krok 2 they mentioned the inflammatory bowel disease. Which one? Ulcerative colitis and Crohn's disease we are having. They mentioned the ulcerative colitis. Same question was there. There also the answer was secondary amyloidosis. Okay, so if the condition, if the kidney damage is happening because of some history, which was some kind of inflammatory bowel disease or some kind of chronic inflammatory condition or chronic infection condition, then it is giving you the hint about the secondary renal amyloidosis. Okay, in the notes, in the description box, I will be providing you the list of those things which you can refer to. Okay, or you can pause the video and you can listen to this explanation again, and you will be comfortable with this one. Okay, so now let me move on to the next one. So here your answer goes to the secondary amyloidosis. Fine, let's move on to the ninth one. Autopsy of a 45-year-old man who died of a sudden cardiac arrest has shown a symmetrical type of the third stage obesity, right ventricle wall burst with the myopericardium, excessive lipopexia under epicardium, microscopically adipose tissue from epicardium penetrates myocardium with muscle fibers atrophy. What pathological process is the most possible? Okay, so look, they're talking about a sudden cardiac arrest. They're talking about a symmetrical type of third stage obesity. Right ventricle wall burst with the hemopericardium. They are talking about which layer of the heart? Pericardium or epicardium? Hemopericardium or epicardium, right? Excessive lipopexia, most important term in this question. Lipo means fat. Under epicardium, Remember, I have talked about the fatty degeneration of the myocardium or fatty degeneration of the heart. That was the tiger heart situation. This is slightly different. That was the fatty degeneration of the myocardium layer. This is the fatty degeneration of which layer? Epicardium or pericardium. Now this is the main thing. If they are talking about the excessive lipoplakia or excessive lipid vacuoles in the epicardium or pericardium layer, then this condition is called as simple fatty heart. This condition is called as simple fatty heart. So guys, you need to remember what? You need to remember actually the layer, which layer is involved. Look, simple fatty layer heart, if they are talking about, they are actually talking about the pericardium or epicardium. Pericardium or epicardium. If they are talking about the fatty degeneration of the myocardium, which is also called as tiger's heart, then they are talking about what? Then they are talking about the myocardium. So be very careful while answering these questions. Okay, if they are talking about the myocardium, in the name itself, as the name said, fatty degeneration of the myocardium, they are talking about the tiger's heart. If they are talking about simple fatty heart, they are talking about the destruction of the pericardium by the help of the lipid vacuole or fatty vacuole or lipoplakia, whatever term they can use, right? Here they have talked about the lipoplakia under epicardium. Okay, let's move on to the question now. Further, microscopically they said that adipose tissue from the epicardium, now it is penetrating into the myocardium, but do not remember where it starts from. It starts from the epicardium or the pericardium. So definitely it is the simple fatty heart, not the tiger's heart. Okay, so please remember that. Remember the origin. Okay, that is very important. So this question is actually simple fatty heart. Okay, I hope that's clear. Fine. So guys, this was about the parenchymatous degeneration and the mesenchymal degenerations. I will be talking about the mixed degenerations and the further topics in the next one, in the subsequent video. If you like the video, please share it with your friends, share among your friends, hit the like button, make sure you subscribe the channel, and if you are having any kind of doubt, you can ask me either in the comment section or either on my Facebook or WhatsApp or Instagram. As far as notes are concerned, I will be dropping them in the description box, or you may pause the video. As I said, meanwhile you may pause the video and listen to the whole explanation of the particular question. Okay, so I will be seeing you in the next one. Till then, take care. Bye.